If you're just joining us, you are right on time because the show just kickstart. All right, today we'll be discussing a vital topic that is related to health, which is World Malaria Day. Tomorrow is World Malaria Day, so today we are beginning to create awareness concerning this health issue, which some people, to an extent, they take it for granted. But I tell you, malaria is to an extent malignant. It is deadly, especially when you don't pay attention to its signs or symptoms. But before we delve straight into the topic, let's give you an excerpt. Today on World Malaria Day, which is tomorrow, we are creating awareness today. We unite our voices to shine a light on one of the world's oldest and deadliest diseases. Malaria is preventable, treatable, and yet it still claims hundreds of thousands of lives each year, with children under 5 and pregnant women among the most vulnerable. Now, this year's theme is Malaria Ends With Us: Reinvest, Reimagine, and Reignite. This reminds us that ending malaria isn't just a medical mission. No, it's a matter of justice. Together, and with awareness, innovation, and global solidarity, we can bring this fight to the finish line. Today, we'll be discussing, like I said, World Malaria Day, and the theme is Malaria Ends With Us: Reinvest, Reimagine, Reignite. We'll be discussing this vital health topic with our amiable guest who just joined us in the studio. She goes by the name Goodness Madueke. She is the Assistant Officer of Advocacy, Communication, and Social Mobilization. Good evening, Goodness.
Good evening, Confidence.
Thanks for joining us. It's good to have you on the show.
Nice to be with you.
You're welcome. Okay, so we're talking about World Malaria Day, and you being an Assistant Officer of Advocacy, Communication, and Social Mobilization. Now, World Malaria Day, let's start with a brief overview of why creating this awareness is important, especially in Nigeria. Why is it important?
So thank you very much for that question.
You're welcome.
Like you said in your excerpts earlier about the damage that malaria has on the individual.
Yeah.
And it's not just a disease, it's a disease that is known globally,
okay,
and which can also lead to death in children, pregnant women, and a lot of us in our homes must have had one or two of those of malaria disease in cases. Our cases in the family.
Yeah.
So it's something that we all need to work together to find solutions towards eradicating.
Mm-hmm.
So for the World Malaria Day event, it's an annual event, okay, which is celebrated every 25th of April, mm-hmm, annually, globally as well. And it's a day set aside to recognize the efforts that have been put in place over the years, okay, and from the 2001 declaration, Abuja Declaration, concerning eradication of malaria, okay, in the FCT. So it's very important that on the 25th of April every year, we recognize, we celebrate all the efforts that have been put together, not just by individuals, by the government, partners, key stakeholders, even the media, in support and aligning with the malaria program in eradicating malaria completely in FCT.
Okay.
Yeah.
So just FCT?
Yeah,
in other states
in other states as well, but you know, we're in FCT, so okay, we are championing the movement to make sure that FCT is captured free, okay, from malaria.
Okay, so in other states, this movement is also being championed.
Yes, it's championed,
okay, okay,
nationally.
I thought it's just restricted to the FCT. All right, talking about this year's theme, which says we should reinvest, reimagine, and reignite. How do we go about it? Because this is 3 things in one. So how do we go about it? Okay,
so the theme, Malaria Ends With Us, mm-hmm, has to do with every one of us. But when we look at the rethinking and the reimagining and reinvesting, what it's trying to say is that we should not just overlook or downplay malaria as a common disease. Okay. Malaria is not just a common disease because it can kill. It can affect the pregnant woman, the fetus in the pregnant woman. Even we as adults, we know what the implications of having malaria, what it can do to our body. So the need for us all to put our hands together and not just talk to ourselves alone. We need to talk to other people on how to do the right thing. We find strategies that will work in eliminating malaria. So we wouldn't just say it's common. So we have every right as individuals. When you go to the facilities, you have every right as an individual to say, okay, I want to get a test done. I want to test for malaria, and you have to use the right kind of treatments or medications in preventing malaria, because many times we just look at malaria as a common man disease or something that we can overlook.
It's kind of a general notion.
Yes.
And,
so
you see some people like take in, is this self-medication?
Yes. I believe we are wrong. It's wrong. And that's why we are here to create that awareness and let people know that self-medication is wrong. Before you can go about taking any medication, you need to do the right kind of test, because not all malaria or not all fever is malaria, rather. So it's always proper to have your test done, and if you're positive of malaria, you be given the appropriate ACTs for your treatment. So that's part of the things that we're looking at. People should have that awareness. People should be knowledgeable about making the right decisions about their health, because it is said prevention is better than cure.
That's right.
Yes.
So what are the signs or symptoms individuals should look out for when it comes to malaria? Because I mean, sometimes these signs or symptoms can be very confusing. You're having signs like, okay, let's say fever or headache. You don't know if it's malaria or typhoid. So are there specific signs or symptoms individuals should look out for when it comes to malaria? Yes.
So in the program, we have two types of malaria. We have the uncomplicated malaria, and we have the severe malaria. So for some of the most common ones that we see or that presents at the facilities in most cases, where you have chills, you have cold, fever is usually one of the signs that we look out for in most cases, to be able to identify. It's an identifier for other symptoms that may appear, maybe like vomiting, nausea, joint pain, so those are some of the symptoms that are uncomplicated that we look out for at the facilities, and also for residents that are having such symptoms, to be able to know that, okay, these are some of the signs. Then while for the severe malaria, it transits from one untreated malaria, where you have not had medication, or you have been exposed previously to the bite of an infected female Anopheles mosquito, which is the parasite the parasite that causes the infection. So if you have been exposed to that parasite, there's a possibility where the individual would now have to come down with malaria. So for the severe malaria, you can have stiffness of the neck, you can have convulsion, those are some of the signs. Epilepsy, that's something that it could even lead to death in most cases. So the severe malaria isn't something that anybody should actually pray for, actually.
So in summary, whatever the sign is, just go for
tests. Yes.
To know,
visit the nearest facility and do the right test to be sure of the problem they're having.
So viewers, self-medication is wrong when it comes to malaria. Don't take malaria for granted. It is malignant. It is deadly. So when you see the sign or symptoms, just like she stated out, just go to nearest hospital, carry out the test to know exactly what is wrong with you, so that you can, have the right medications. All right. What specific projects or campaigns is the federal government working on in order to accelerate malaria control in Nigeria?
All right. So currently we have various projects, or should I say interventions, that are ongoing, supported by the government and partners. But we have a project ongoing in 5 states, which FCT is part of it, which is Life and Livelihood Fund Support for Malaria Elimination Program, which has to do through the Islamic Development Bank. Yes, they are the ones supporting while the FCT is implementing the project. So it's all about free treatment of malaria, and also free testing of malaria in all public health facilities in the FCT. So that's one of the projects. And we also have seasonal malaria chemo prevention, which targets children between 3 to 59 months, and it's an intervention that is done during the high rainfall season, like when we start in June. Those are interventions that the government is also supporting, or with other implementing partners in achieving that. It's also through a door-to-door strategy that we are doing that. So we have intermittent treatment in pregnancy, and this targets pregnant women. So we know that these anti-malarials prevent the mother and the child from coming down with malaria during the periods of pregnancy, which is given to them at the second 13th weeks, or when there is kicking by the pregnant woman. So those sulfogdine pyrimethamine is given to mothers to prevent, for prevention during those periods. And we also have a campaign, an LLI campaign that will be starting very soon through the project that I spoke about earlier, the Life and Livelihood Support Fund. So those are some of the projects that government and partners are supporting to ensure that malaria elimination is fast. It's going to quick,
But I want to ask a very funny question. It has to do with herbs. Are you in consensus with, individuals using herbs to treat malaria? Because you hear them say it's very effective and it doesn't have side effects, it's natural and all that. Are you in consensus with that?
Well, as a medical person, I wouldn't really say that it's the right thing to do, because in most cases, you don't run a test or you don't do any assessments to say, okay, this person actually had that disease. Just something that you go to a roadside or go to a herbal medicine vendor and say, okay, prepare this for me. This is what I feel are the signs that I'm having. So ordinarily, we don't recommend that we don't recommend that at all. So it's always proper to do it the right way. When you feel or you have those signs, just go to the nearby facility and you get tested, and if you're positive, you take the right ACTs.
All right, so viewers, you've heard from the horse's mouth. Herbs can never be an alternative. So when you have the signs or symptoms, just walk into a health facility, get tested before you can, get any medications for the malaria treatment. All right, so what role does community education play in malaria prevention? What role does community education play?
Okay, so the community on its own is very vital in terms of achieving, for any project to succeed at the community level. It's always very important that you close the gaps, especially in terms of educating the community members. So we have trained community mobilizers, we have educators at the area council levels that are being trained, even the traditional leaders, the World Development Committees, the Village Development Committees. These are stakeholders in the community that we engage time to time to inform them or educate them about malaria prevention, diagnosis and treatment, and the kind of messages that are culturally sensitive to the people, so that they can be able to integrate more with what we are doing at the state level and the national level as well.
All right, what are the biggest gaps you see in Nigeria's public health response to malaria? I mean, our public sector, I won't say it is 100% good. So what are these gaps, this biggest gap you see in Nigeria's public health response when it comes to malaria? What are these gaps?
Well, first of all, I would say knowledge gaps. We have a lot of knowledge gap. We have misconceptions about malaria, the malaria program, about the prevention program, about the treatment guidelines. So these gaps in the system, especially in terms of public health information, people are not informed about the right kind of processes that needs to be taken. They just feel that, okay, it can be done the other way, the other route, without going through the normal process that's needed. So if they have the right kind of knowledge, I believe that gap can be closed. Then for the interventions, like I likely said, we have a project ongoing, which is the seasonal malaria chemo prevention, SMC. One of the challenges that we have faced, over the years, but we are growing past that stage, is with gated houses.
Okay.
You get what I'm talking about? Houses that have gates and you can't access. Looking at the kind of strategy that we are implementing with where the community drug distributor has to go from house to target these children. So in most cases, some of these children are not being brought forward because of where they live. So I feel if the residents of such areas or those residents of such estates are knowledgeable or are equipped with the kind of interventions that are ongoing, they will avail their children to participate in the program, as well as tell other people to be part of it, so that we can get all our children safe and free from malaria during the raining period.
Okay, talking about the rural side now, that's the rural communities, are there challenges you've faced so far in terms of, you know, implementing this intervention, these malaria interventions?
Well, let me say we have been having successes with the rural areas, because before you go into any rural community, you have to be in close relationship with the community, and you have to go use the right directions, you have to go to the right kind of people, and you know, the gatekeepers are very essential in getting the kind of result that you're looking for from that community. So once we've gotten the approval of the traditional leader or some person that has a very high stake in the community, it has been successful, I must say.
Before we move further, let's discuss the causes of malaria. I think it's very important. We've discussed about the signs or symptoms. What are the causes of malaria?
Okay, so the causes of malaria are, should I say, overall environmental mismanagement. And the environment serves a very huge purpose for we humans that are living in it. And it's very important that we clear the bushes around us. Hygiene is very important as well. So what actually causes that malaria is because of the breeding sites that are around us through the infected mosquito, where the infected mosquito can lay eggs, and from there infect one person, which can lead to transmission to other people. So that's particularly is one of the major causes, through the parasite itself, which from there transmits from one person to another. So you need to be infected. The mosquito needs to be infected before a transmission can occur. So once that transmission, there is always a reinfection if the causative has not been tackled, which includes the environmental sanitation. And one of the new information people are not aware of is that even clean water could actually cause malaria. So let me give you an example. We have, when we go on the street, we see tires, you know, here and there, and when the rain falls, you find that the water gets stuck within the tires. So during that period, what does it do? The mosquitoes around that area begins to incubate within that terrain. And that's why you see that once there's an infected person, maybe that have come from another state or have been infected before, it takes the blood, and you continue to see people coming down. So if we can make sure that those tires, the water that you keep them off, even the pure water leather, that we some of us leave water in it, we don't dispose them appropriately. So at the end of the day, you still see this water stuck here and there. So those are the things that lead to breeding sites for these mosquitoes to lay their larvae, and at the end of the day cause a nuisance in the communities.
So can you shed light on the preventive measures when it comes to malaria? What are the preventive measures we should take cognizance of?
Okay, so we have some of how you can prevent them is by sleeping under the long-lasting insecticide nets. Yes, the pregnant women should sleep under, the children should also, under 5, should also sleep under the treated mosquito nets. And also attending antenatal care. Some women don't actually see it as anything. They just see, okay, when I'm pregnant, we are just double. So anything that happens to me does not affect. All I just need to do is to eat nutrition. But it's beyond that. When you find out that you are pregnant and it's at 13 weeks, the first thing to do is to visit the nearest primary health care facility. closest to you, and from the time of your visit you get the necessary support and services that is needed, and then you'll be given an anti-malaria drug, which serves as a prevention that you'll be taking in with other routine drugs to prevent the fetus from endanger, because it could lead to miscarriages, stillbirth. Some of them may even lead to death. So these are some of the preventive measures that you can take. So for the children 3 to 59 years, we recommend SMC because we have found out that it's very effective, it's reliable. SMC has been reliable. So over the years, those are some of the preventive medicines that we give to these children within 3 to 59 months of age. And for adults, you have the recommended ACTs. When you go for tests, you are positive, you take your ACTs that are recommended. We have artesunate, lumefantrine, we have artesunate, dipyparaquine. We have some other types of artesunate medications that can be given to the individuals. And yes, we also have sanitation, so something you can prevent. So when you do some of those things, you prevent yourself and your family from coming down with malaria. And also wearing long clothes during the evening time, because we know that the only time that the mosquito gets to bite you is in the evenings, during the night preferably. So it's always best that when you're going out or you have anything that you're going to do outside, wear cover clothing at those times to prevent yourself from coming down malaria. Okay, Goodness, thank you very much. Before we let you go, just say one or two things to the viewers out there concerning the World Malaria Day. Okay, so tomorrow we are the FCD Malaria Program will be having its World Malaria Day celebration at Asokoro General Hospital. We'll also be having outreaches at Kuchingoro community at Lugbe Aziz. We're also looking out for Paduma communities to also do some outreaches and share services to community members. So another thing I would like the community, the residents of FC to know is that we have a project ongoing. So go to the nearest facility, public health facility, get tested, get treated, and if you're positive, take ACT. If you're negative, you don't really need it. All right, thank you so much. It was nice having you on the show. Hope to see you some other time, because we're not done tapping from your knowledge. Thank you so much. All right, viewers, we've ended the first segment on the Engendered show. I hope you've learned one or two about malaria. It has nothing to do with gender. It affects both the male and the female, even pregnant women. So when signs or symptoms comes up, just walk into any health facility, get tested, and then you take one or two medications so that you can be fine. Stay away from herbs, just like our guest said. It is not an alternative. Stay away from herbs. Just get treated medically.